I'd like to introduce Scott Newport. The Hope Award was created by he and his son Noah in remembrance of his other son Evan, who was a patient here at CS Mott Children's, and really want to thank Scott for all his contributions, and not only with the awards, but just with the Michigan medicine in general. So with that, I'll hand it over to Scott.
Thanks, Keith. I really appreciate that. Over this past Thanksgiving, I went for a run, a 6-mile run out at Mount Holly State Recreation, which I do often. And it's a trail run. And on my run, I was thinking about Evan because, as some of you know, Evan passed away on the day after Thanksgiving quite a few years ago. And as I was running, a thought came across my head and stopped for a minute. And I thought, man, this really is an interesting thought. So I wrote it down on my phone and sent it to me in an email. And the thought was, or statement was, every mistake has a history, and every new thought considers the future. And when my son died, the day after Thanksgiving, it was the day I thought I had made a mistake. And for many years, I had grief about that. And today we're here to remember Evan, but also to recognize all these great folks who have done all this great work in a patient family-centered care at the University of Michigan Health Systems. Again, every mistake has a history, and every new thought considers the future. And as I was thinking about it today, about you guys, all the nominations and all the great work you've done, I had to think that, I did make a mistake back then, and it was like Evan's future was over, but today's a great memory to think about. Evan's future is this award, which means it is not over and it wasn't a mistake. And as we continue on in our work at Michigan Medicine and all the work you guys are doing, your future, your new thinking is considering all us patients and families like mine, that have gone through the hospital. And without you nominees and all the people at Michigan Medicine, staff and faculty, volunteers, all that, without this work and thinking we couldn't be as great as we are. So I'm just so happy to congratulate you guys and to remember Evan. I just found this picture I thought I'd share with you, and hope you guys have a great day. I can't wait to hear the winner. And I'd like now to pass it on to Molly White, one of my favorite people. She's a great fan of Michigan. Go Blue, go girl. And hey, Molly, it's great to see you. Take her away.
Great to see you, Scott.
Yeah.
I feel like we're in the same room, although obviously I've got a winter scene here behind me, and I wish I could have joined you on that 6-mile run. Thank you, Scott, and thank you to the Newport family for always just continually giving back to Michigan Medicine, not only through this award program that you launched for us, but that each year you come back to inspire us. And in between that, you're also working on so many projects to help folks from end of life to in the moment needs that patients and families have. So thank you. Great to see you. So everybody, thank you for joining us today to celebrate the wonderful individuals and teams that not only have embraced the practice of patient family-centered care, but they've brought it to a new level. They've been recognized by their peers as exemplars. As Mr. Rogers once said, look for the helpers. You will always find people who are helping. To this day, especially in times of disaster, I am always comforted by realizing that there are still so many helpers, so many caring people in this world. Thank you, Mr. Rogers. So thank you to all the helpers here at Michigan Medicine that have seen patients and each other through our toughest year in history. As you can imagine, it is really incredibly difficult to narrow down the many amazing nominees into these finalists. Thank you to our selection committees for taking on this daunting task. And a quick note that because of our need to switch to virtual, and thank you for everybody for coming along for the ride, we've embedded today our, with videos from the teammates across the system with some of their comments on the nominations. We'd rather be together in person, of course, but bear with us as we deal with the technology. Some of the videos are low resolution. So we'll go ahead and get started. For adult services, the individual finalists include Carrie Battles. Carrie Battles is a nurse nomination, and we're hearing from one of her peers that nominated her for. We will hear shortly.
She's always focused on her patients, gentle, kind, getting to know them, laughing with them, and anticipating their needs. More recently, Evan Newport's dad, Scott, also said that hope replaces fear. Recently, fear became a big part of nursing as we were redeployed to the trauma burn ICU. During that time, Carrie was paired with an ICU team caring for one patient who was especially ill. As other patients came and went, her patient remained. Twice, it seemed hope was almost lost as her family came in to say goodbye, and Carrie returned that night to continue caring for the patient. Eventually, the patient was transferred off the unit, and Carrie and I returned to our home unit of adult medical short stay. We often talked about her patient and wondered whatever happened to her. Thankfully, we learned through media coverage that after 196 days at U of M, her patient was discharged home with her family. It was a great recognition of hope and what that can bring to each case. As Scott Newport says, let our passion for patients and families tie us together. I'm so grateful to be tied to Carrie, to see her passion for her patients and her concern, always putting others first, whether it be her colleagues, her patients, or her own family. Thank you for allowing me to recognize Carrie today.
Thank you very much, Carrie. And we'll be sending out the videos so people can watch them at home as well. And our next finalist, Judy Benkeser.
It's a pleasure to talk a little bit about Judy Benkeser and what a great partner she's been in Taubman Primary Care Clinic for many years. Judy brings enormous personal dedication to the patients, goes way out of her way to both assess them and intervene. Hospital visits, home visits, calls to community partners. There is no stone that Judy isn't willing to unturn to get help to our patients. So she goes way past the ordinary health professional's scope of service. She also has an encyclopedic scope of knowledge of resources and people in the community, and seemingly has an endless stream of people she can call to do home visits, legal affairs, placement issues. It's really remarkable. She clearly doesn't take anything as not her job, and takes the whole view of the patient and their community into account in trying to improve their health. I think one of the things I enjoy most about working with Judy is that as a team member, she brings insights to the table, and she's always able to help me understand the things that I'm missing. And she's hardly ever wrong about what is happening with the patients. And she has a very professional, pleasant, insistent, and unstoppable way of bringing me around to the getting done or doing the things that are most helpful, even when I'm not seeing them clearly up front. It's remarkable. So thank you, Judy. Thank you for being who you are, and I hope you can continue working on our team for a very long time.
Hi, my name is Hannah Tucci, and I'm very excited to nominate Sam Judkins for the Hope Award. There are many stories and patient cases that I could share highlighting Sam's care. Sam is incredibly compassionate, caring, and a patient-centered nurse supervisor for 8D. Sam spends most of her day making sure the patient and her staff are supported. She spends most times and hours speaking with multiple interdisciplinary team members to ensure that concerns for the staff and patients are met. Sam is willing to partner with members of all of the interdisciplinary team and is always a supportive presence. Despite very busy days, she takes time for her staffs and patient when needed. She is willing to stop what she is doing to make sure needs are met. It is a delight working with Sam on a daily basis. She brings so much joy and fun to the unit. I'm thankful to be her colleague, and I know that the patients continue to benefit from her care as well. She doesn't hesitate to join in when there are needs and staff shortages, and to listen when she's needed. I have witnessed Sam at bedside with patients when they are actively dying and no family is able to be present. She ensures the patient is well cared for, comfortable, and advocates for any needs they might have moving forward. I really hope you guys will consider Sam for this award, as she is a wonderful person, a wonderful nurse, and wonderful to work with.
Thank you, Sam. And our next finalist is Joseph Norman. Dr. Norman.
I'd like to say thank you to Dr. Joe Norman for his exceptional example of patient-centered and family-centered care. And I'd like to briefly introduce Dr. Norman, who's sitting next to me here.
Hello.
And say thank you for everything that he has done. The other day, I was walking through the halls at Chelsea Hospital, and the nursing director, Lori Williams, came up to me, and she presented me with 2 Daisy Award applications. She had said, you know, we typically don't get these for physicians, but I thought that this might be something that you would like to see. And so I'm going to just give these to Dr. Norman and ask Dr. Norman just to read some of the comments, that these patients wrote.
Sure. This one is from September of 2020. Dr. Norman was so gentle and kind. When I was at my worst, he saw it and executed the problem. He also got down at my eye level when I couldn't sit up, and that shows how personable he is. My mom and I appreciate every question he answered and the time he spent talking to us. Love from our patients. And another. All right. He saved my life. And some other items here. He fixed my medications, listened to me, convinced me not to leave against medical advice, inquired about serious health-related issues, worked with past and present medical to get records and determine if, when surgery might be needed, and best local places. Spent a ton of time talking, listening, asking questions. Very smart, kind, and respectful to all. Even bought me a mascara and hairdresser. I was embarrassed not to have them. And I liked okay. Even bought mascara and hairdryer. I was embarrassed not to have them. Liked and respected by all. Makes Chelsea a better place. Wow.
Dr. Norman, thank you very much for what you do for Michigan medicine patients.
Thank you, Dr. Norman. And our next finalist for the individual is Dr. Tapper.
Dr. Tapper, I'm being selected as a finalist for the Evan Newport Hope Award for Adult Services. Dr. Tapper, you are a prime example of a physician who embodies patient and family-centered care. Ever since I started working with you in 2018 to help improve the processes for our cirrhosis patient population, you have taken every opportunity to engage both our patients and their caregivers. Through focus groups and other means, you used our patients' personal experiences to help identify their needs and fill the gaps in our own processes. And that has led to numerous improvements, and it continues to do so. Congratulations on this honor. It is well deserved.
Thank you, Dr. Tapper. And the winner is Judy Benkeser. Thank you, Judy, for everything that you do. I don't know if you're here with us today. If so, if you want to say a few words. Okay, we'll go ahead and move on to our next area of award nominations, which will be for team finalists in adult services. And the first one, it goes to the Care Management Social Work Team.
Ann Randazzo, the 8C inpatient social worker, and I'm proud to be part of the Care Management Social Work team. Care Management Social Work is comprised of 80 social workers working in the emergency department, university hospital, children and women's hospital, and more recently, due to the pandemic, the RICU. Care Management Social Workers are unit-based and manage all the psychosocial needs that arise with patients that are admitted to Michigan Medicine. Specific to the pandemic, the Care Management Social Workers' roles extended to not only provide support and resources to all of the COVID-positive patients admitted, but also their loved ones isolated at home. We also manage new ways to include families in patient care and important medical conversations when they were not allowed to be at bedside due to visitor restrictions, and how to navigate the new complexities of end of life with the COVID-positive patients and visitor restrictions. I'd like to introduce Emily and let her speak to the details of what it was like to redeploy from her home unit and learn to navigate the RICU, the unique complexities of care for some of the most critical COVID-positive patients.
Hey, thanks so much for that introduction. My name is Emily Fagre, and I am a float social worker at Children and Women's Hospital. But during the height of the pandemic in the spring, I redeployed to the RICU. In the RICU and other units managing COVID-19 patients, Care Management Social Workers created completely new workflows and became integral parts of new interdisciplinary teams. We learned how to connect families with critically ill patients through video and phone calls, attempting to forge meaningful connections whenever possible. Far too often, we help guide families through the process of saying goodbye to their loved ones under the most challenging of circumstances. This included facilitating visits for only 2 family members to come to the hospital, or finding ways to provide comfort to families who couldn't be present. We also got to experience the joy of patients surviving COVID-19 and help them return safely to their home and transition to their communities by providing resources and addressing barriers to discharge. Care Management Social Workers are present through each step of a patient's admission. Social workers in the emergency department are our first line in providing support and assessing for urgent needs. I'd like to introduce Rebecca to speak about the role of ED Care Management Social Work.
Thank you, Emily. Hi, everyone. My name is Rebecca Pinard, and I am a proud member of the Care Management Social Work team serving adult emergency services. Care Management Social Work in the emergency department requires quick rapport and efficient interactions with patients and their families. We are often the first members of the care team to initiate contact with and meet the family. We work to get them updates regarding the patient's condition as quickly as possible. Normally, we are tasked with joining patients with their families at the hospital to promote the first stages of healing. During the pandemic, however, we were tasked with facilitating separation from families due to visitor and waiting room restrictions. We work to provide emotional support, updates, and reassurance in a multitude of ways. We met with family members in their cars, outside the doors of the ED, and over the phone. Needless to say, this was a dramatic twist from our norm and certainly challenging. While we are often first line in connecting with families, we are reassured in knowing what a great team of inpatient care management social workers are available to them upon their admission. Thank you, Jillian, for the wonderful and thoughtful recognition of our work. I truly believe care management social work is a pivotal and important part of healthcare at Michigan Medicine, and it is such a blessing to have an opportunity to come together and be acknowledged as a team. Thank you again.
Thank you, Care Management Social Work team. And our next nominee is the Department of Respiratory Care. I am so happy to nominate the Michigan Medicine Respiratory Therapy team for the HOPE Awards this year in 2020. So already a dynamic team that offers respiratory therapy to patients in some of the most critical condition. These compassionate therapists provided cutting edge therapy and treatments this year, always putting patients first. And I think what's especially notable is how they came together and played such a critical role in this year's pandemic. So during a time where we were learning a lot about a disease we didn't know much about, they were discovering new aspects and nuances to the care of that's needed for the patients with COVID-19. And not only worked with the care teams, physicians, nurses, spiritual care, social work to help to support the patients, but also the team members while discovering new things and sharing it with their peers and other organizations. This team did everything from hand-holding patients that were alone, and many deaths, that they were supporting folks at the hardest of moments. They provided up-close personal care to patients, calling family members, working with practitioners hand in hand, basically developing new therapies in the moment. I want to thank them, but also nominate them for the Hope Award this year. Thank you. Thank you to the Department of Respiratory Care. And our next finalist is RICU. This Evan Newport Hope Award nomination comes from Dr. Vineet Chopra, and it is for the Regional Infectious Containment Unit, otherwise known as the RICU. Though this team is a finalist in the adult system section, I wanted to point out that this team actually resulted from a system-wide effort to even open the RICU in Mott Children's Hospital floor, 12th floor. Facilities teams had to work tirelessly to ready the negative pressure units for the patients. The surge only beginning in March, by April, every bed in the RICU and expanded RICU was already full. Underscoring the gravity of these moments, patients were on mechanical ventilators requiring respiratory therapists to work around the clock with physicians, nurses, PAs, care management, social workers, spiritual care, and others. To make it easier to doff PPE, material services teams stocked line carts outside the rooms with the essential items needed to minimize the going in and out. HITS worked rapidly to create a pager system to facilitate communication with pharmacists, nutritionists, and physical therapists, all to minimize personal contact. Our safety leaders worked to ensure everyone on the floor was briefed on Michigan Medicine's new COVID safety protocols, which included bundling tasks and using runners to minimize in-room time. Environmental services staff adapted their disinfection practices to meet the new demands. Physicians and nurses from surgery, MA, ambulatory care services stepped out of their usual roles to volunteer to cover shifts in the RICUs, and ECMO specialists were stretched to their very limits. Meanwhile, visitor restrictions are in place, leaving patients feeling scared and isolated, and families at home worrying. So these staff, this amazing RICU team members, exhausted, overwhelmed, they stepped in as family, holding hands, calling family members regularly to keep them close. The RICU team carried these burdens home with them, even as many were living apart from their families due to exposure concerns. The unity of purpose seemed to intensify the camaraderie of the RICU team, because even as fatigue set in, RICU team members were often overheard, making a habit of personally checking in on each other, asking, "Holding up okay? Do you need anything? What can I do?" This team exemplified Michigan medicine values and patient and family-centered care principles to the max. Thank you to the RICU multidisciplinary team for your service, and indeed, hail to the front line. Thank you to the RICU care team. And our last finalist in the team category is 7C,
Cardiology. I work just down the hall from 7C, and that's the team that I'm nominating for the Evan Newport Hope Award. The 7C team excels in all the aspects that the Hope Award seeks to encourage. I see the team go above and beyond daily to put patients and families first. But the whole team, multidisciplinary effort they put forth to provide the finest care to a complex patient that I'm going to tell you about was absolutely extraordinary. I'll call the patient Sam. That's not their real name. Sam had a very complex hospital stay. It lasted several months. Complications resulted in multiple deficits, including impulsivity and dysphagia. The dysphagia was very frustrating to the patient, causing emotional outbursts, while the impulsivity created a very real potential for self-harm. Staff tried all the traditional interventions: patient attendance, frequent rounding, remote video monitoring, all to no avail. They either escalated the situation, weren't timely enough, or weren't available. So the team got creative. They adjusted staffing ratios, allowing for the patient to be more closely supervised by nursing. They developed an innovative, unobtrusive method of monitoring the patient from just outside the room, keeping the patient and family safe, and staff safe, while maintaining peace and dignity. Nursing staff frequently brought patient on walks throughout the hospital, helped order favorite meals from restaurants, and would even share in the unit's potlucks back when they were allowed. On one particularly trying day, Diane, the unit's nursing director, found a soft fleece blanket and gave it to the patient. This helped de-escalate the situation and immediately made her a favorite. From then on, the walks that the patient took usually included a stop by her office. On another rough day, Sam spent a significant amount of time drawing and coloring in Diane's office. Diane convened an expanded interdisciplinary team involving the patient's care team, both nursing and medicine, Sam's family, as well as hospital executives, and they moved mountains to solve problems for this patient. Over the course of the next several months, I observed the whole team, including Jill, the AA, several unit clerks, Andrea, the clinical nursing supervisor, social work, and too many nurses to name, make extraordinary efforts to keep the patient safe and provide exceptional, compassionate care. These are just a few examples of how the team managed an unusually difficult situation on just one patient. However, the exceptional effort, patient family-centered care, and outside-of-the-box thinking, and multidisciplinary team collaboration can be seen daily on this unit.
Thank you so much to 7C. And the winner is the RICU care team. Congratulations to the RICU team. I don't know if Alex or Julie are available to speak. We would love to hear from you if so, and congratulations to the other team nominees.
Thank you, Molly. This is Julie Juno. Can you hear me? Okay, great.
Yes.
It is an honor to accept this award on behalf of the entire RICU care team. Vineet did a beautiful job of describing the environment. There are so many people that were involved in making this, bringing a unit from a pediatric unit into an adult intensive care bed and then doubling the beds was really quite a feat. It took a nation, not a village, of Michigan medicine to bring the RICU to life. And we are so grateful we had all the team members with us. It was really a unique experience. This brought people from all over the hospital together to work together in a very critical situation where we were really scared and didn't know what to expect. But people working together who had never worked together before, coming together, finding a way to be a truly effective and high functioning team in a relatively quick period of time. I think demonstrating that we truly are better together. I can't thank everyone individually because there's so many people, but watching the staff really take those extra moments and work their magic to be able to bring family-centered care to a time that was focused on isolation and separation. And as Vineet mentioned, really watching people take the time to fill the spaces when families couldn't be present. I will be forever grateful for that experience and always changed. I would like to let Alex say a couple of words about nursing in the front line. So Alex. And
Thanks,
thank you
Julie.
again, everyone.
As Julie has said, the task of getting the RICU and 12 West up and running was an amazing feat, and I'm pleased to have been part of that team. We'd like to extend a special thanks to our ACNOs, Julie Grunewalt and Kelly Baird-Cox, our medical directors, Vineet Chopra, Dr. Jake McSparron, Dr. Ross Blank, for meeting with us daily to make sure the unit had everything that we needed on a day-to-day basis. In addition to that, we'd like to take a moment to recognize that although this award is be given to the RICU and 12 West, but it is important to recognize all the frontline staff from the inpatient units from all over Michigan medicine that have stood together in the face of the pandemic and care for these patients affected by COVID-19. So to everyone from around Michigan medicine, MDs, RNs, assisted personnel, RTs, APPs, facilities, engineering, pharmacy, social work, we thank you. Without your support, ability to work together, volunteering to work extra shifts, being redeployed to unknown areas, and taking on higher patient ratios under adapted staffing models, the RICU and 12 West would not have been successful. The Michigan medicine community has really pulled together to care for all of our patients during this pandemic, and I'm truly proud to be a nurse leader at this institution. Thank you all for the work that you do. And thank you for nominating us, Vineet.
Thank you so much. It's great to hear from both of you, Alex and Julie. And again, really great, amazing. Really, there were just too many people to name individually that came together. And like you mentioned, coming from different areas and seeing it well orchestrated, and the work that you do and can continue to do. Everybody, as they've gone back to their other locations where they work, has been pretty phenomenal. Thank you so much. And Judy, if you're available, since we weren't able to get your mic unmuted last time, I wonder if you're there. We'd love to give you a moment to speak to your award from the individuals.
Can you hear me now?
We can, Judy. Yay.
Oh, good.
Great to have you. Congratulations.
I am so honored to receive this award. I work with the most amazing clinic group I can ever imagine having the privilege of being with. And I do my job well because everyone here works so well together and always maintains their patient focus. And I just thank everyone for this honor. Thank you.
Well done. Thank you so much. All right, now we're going to move on to the Children, Women's, and Psychiatry individual awards. So let's begin.
It's with great pleasure that I'm nominating Michele Brown for this great honor of the Hope Award in the Office of Patient Experience. Michele Brown is a supervisor in the Department of Psychiatry. She supervises social workers, trainees, and she runs our care management program. She's one of our most stellar social workers. She has been the co-director of Psychiatry's Patient and Family-Centered Advisory Council since its inception in 2011. She has been a wonderful lead for meetings and has been involved in all of the committee's innovative and meaningful projects. She has shepherded the group to participate in providing feedback for research initiatives, department policy changes requiring PFAC feedback, and she has led improvement projects impacting how we deliver care in the hospital section and psychiatric emergency services. She is an effective moderator and also keeps the meetings organized and on track. She provides excellent agendas and minutes. She has initiated and helped to organize and facilitate events that involved activities such as donuts and apples in an attempt to recruit more volunteers. She is warm and joyful. She even bakes for certain meetings. She creates a welcoming, respectful, inclusive atmosphere for our diverse group of volunteers. She is also the backbone of the committee. She has worked tirelessly on behalf of the Patient and Family-Centered Initiative. She deserves our thanks and recognition for her hard work. She has been consistent and dedicated to improving care for patients and families in our psychiatry department.
Thank you, Michele Brown. And our next finalist is Marybeth Carlson.
Taking care of my child. I have gone through the trauma of having a loved one in the ICU, and I can tell you that Marybeth provides family with communication, care, advocacy, respect, and professionalism that can make all the difference in the midst of an unimaginable circumstance. Marybeth's kindness and compassion help her to create patient, family-centered goals with the family she cares for. When families do not have the strength or knowledge to advocate for their children, she educates them and advocates for them whenever she can. She works together with all members of the healthcare team to get and achieve the best possible outcomes for her patients. Recently, Marybeth cared for a family that had been through a very hard time. Her patient's hospital stay was prolonged by unexpected complications. The family trusted in the healthcare system, but that was broken. There was a breakdown in their relationship with many care providers because of this. Marybeth helped to provide consistency in the care for this family. As a member of this patient family primary team of nurses, she helped build their trust. She identified opportunities to improve communication of the patient and family's specific care needs. This indeed helped the family feel hopeful that their hospital course would improve. She empowered the family to participate in the care and advocacy of their child when they felt things were out of control. Marybeth is, in fact, patient and family centered.
Hello, I'm Anne-Marie Ramsey, nurse practitioner and member of the Pediatric Home Ventilator team. I nominated Ashley Jentz for the Evan Newport Hope Award to recognize her outstanding dedication to families. I had the privilege of being a member of Evan's care team and got to know Scott and Penny, Evan's parents, very well. I believe they would also admire Ashley as an advocate for families. She truly believes every family, no matter what barriers exist, have strengths. With the support from other family members, the medical team, and resources in the community, families can successfully provide care for a medically complex child requiring ventilator support at home.
Hey Ashley, it's your RT crew. We just want to let you know how much we appreciate you. What a great job you do for our patients, and we just want you to know how much we appreciate you every day.
Your attention to detail is flawless, and I'm always blown away by your knowledge base and just how much work you put in for our patients and families.
Ashley, I've always admired your persistence, your compassion, and your composure when dealing with daily struggles that our patients face, and always putting the patient first. We thank you for being such an amazing and integral part to our team.
I've had the opportunity to work with Ashley both as a bedside nurse and more closely as a nurse practitioner on the pediatric ventilator unit. I've always been struck by how far above and beyond Ashley will go for every single one of our patients and families. From identifying barriers and then resources to help overcome them, to simply listening to patients and families to make sure that their voice is heard to the entire medical team. It's truly inspiring to work with her.
Ashley, we're so impressed with your ability to be an amazing patient advocate. Thank you for being a great example to us all the time and leading our team in that ability.
Ashley, your hard work allows other members of the team to be more efficient at our jobs, and our families would be lost without you.
Ashley is passionate about what she does. She works tirelessly for our families and patients. She has so much compassion for people, and she really works magic in terms of finding resources where none of us think there are any. She is caring but tough when she needs to be, and I think really what she does is brings hope to families as well as to our team when we need it.
Thank you, Ashley!
Thank you, Ashley. And real quickly, I'll just mention, if you want to share your shout outs to folks, just remember to select all panelists and attendees. If you just do panelists, it just gets to a handful of folks. So all panelists and attendees. Thank you, Ashley. Okay, our next finalist is Alex Peahl.
My name is Luann Thomas Ewald, and I nominated Dr. Alex Peahl for the Hope Award because early in the pandemic, I believe it was late March, Dr. Peahl and her team really identified a need for our expectant mothers. We quickly knew that they were scared to come into the hospital. And so what she did along with her team was really redesign the entire prenatal care process and really tried to coordinate a lot of the visits and have multiple things happen at a visit instead of having to have the mother come back multiple times, especially during the pandemic. So usually for prenatal visits, they could be in the range of between 10 and 14 visits throughout the pregnancy. And it was redesigned to really have an in-person visit only 5 times and then have another 4 to 5 virtual visits. In addition to redesigning prenatal care, which had not been done in a very, very long time, she also examined ways where there could be hospital at home components. So very early on, she reached out to me to see if we could find a donor or find some funds for blood pressure cuffs. So moms at home could monitor their own blood pressure and monitor their own weight, and then only really have to come into the hospital when it was absolutely necessary, or if the mother was in distress. So just redesigning and quickly restructuring the entire process, which we know now is and will continue to be best practice. So while it was designed in a crisis, I am confident that we will continue with this process going forward. And Dr. Peahl was featured nationally on the Today Show and in the Wall Street Journal about the quick thinking and quick redesign to focus on our patients. She also coordinated a lot of virtual support visits for our expectant mothers with behavioral health and social workers to really make sure that our patients continued to be in touch with us throughout the pandemic. So for all of those reasons and many, many more reasons, I could go on and on. I nominated Dr. Peahl for this wonderful, wonderful award. Very deserving.
Thank you, Dr. Peahl. And our next finalist is Melisa Scott.
My name is Joanne Moutinho-Bailey. I'm the director of the Nurse Midwives here at Michigan Medicine. It's my honor to congratulate Melisa Scott, a certified nurse midwife, on her nomination for the Newport Hope Award. Just to say a couple things about Melisa, she's been at this institution for many years, first as a labor and delivery nurse and then as a nurse midwife in our group. She has accomplished many things during that time, not least of which is helping to launch centering or pregnancy prenatal care, which is a group prenatal care model aimed to reduce the worst of our health disparities here in this country around preterm birth and maternal morbidity and mortality, as well as also launching a support group with one of our social work colleagues called Our Village, which is specifically for pregnant and postpartum African American women to come together in a supportive structure, not providing health care per se, but just creating an environment of support and shared listening and resourcing. Melisa is a unique person in her way of looking at the world. Any rule that she comes across, she sees if it's going to be a barrier to providing the best possible care for people, and she's always willing to go that extra mile, including bending some of the rules in order to accommodate the needs of families in the way that they're best able to access care. Melisa, we're so lucky to have you here, and congratulations.
Thank you, Melisa. And our winner is, this is a tough one, Melisa Scott. Congratulations to Melisa. I don't think she's on today, was able to be here today, but if you are, Melisa, let yourself be known so we can let you be heard. Congratulations to all those finalists and to Melisa. Incredible work.
Can you hear me?
Oh, right, great. Yes, we can.
Oh, thank you so much for this award. It's really just like the whole leading force for me for providing care is to have a patient-centered experience where the woman is and her family is at the center of every care experience. So thank you for this award, and thank you to the donors. I appreciate it.
Thank you, Melisa. So now we're moving into the team finalists, Children's, Women, and Psychiatry Services. Though we'll give a little bit of a disclaimer that some of the teams expand beyond those areas, just as the RICU expanded, was inclusive of across the system. So keep that in mind, and we'll get going into teams. Our first nominee or finalist is the Cystic Fibrosis.
My name is Kathy Enox. I'm the Pediatric Cystic Fibrosis Center Program Coordinator. Although we have a large group of over 50 people on our team, I nominated specific individuals from our multidisciplinary cystic fibrosis team for a specific case where patient and family-centered care was clearly and expertly delivered. A large family with multiple children had a school-aged child diagnosed with cystic fibrosis. Normally, this test is screened during newborn screening as an infant, but none of these children had newborn screening, which meant we needed to now test the entire family. When the social worker, Julie, the dietitian, Courtney, talked to the mother virtually before her appointment with Dr. Caverly later in the week, they heard the parents' wishes to not tell any of the children the diagnosis yet, so the parents could handle it. Some of their children were very anxious and would also need testing to determine if they had the disease. So this was communicated immediately to the team. The RNs, Jordan and Morgan, began coordinating with the team to try to find time for appropriate parental education while not revealing anything to the children, as the MA coordinator, Carrie, found enough rooms to accommodate the situation. Then Courtney, the PSA supervisor, got them scheduled in clinic, while the PSAs, Jessica and Heather, coordinated the specialty testing scheduling. Then, with little notice, of course, something goes wrong. The parents' babysitter fell through. So originally they were just going to bring the one child and we would worry about scheduling the others for testing later. But suddenly the entire team started acting quickly to not only handle the extra children, but to use it as an opportunity to test all the children at one appointment. So the physical therapist, Chris, and the pharmacist, Hannah, were flexible to come to educate the parents during the appointment when the other children were not around. Jessica from Child Life was involved to assist in the positive coping during the long visit. And the RTs, Kelsey and Jody, occupied some of the children, while Mark, Sharon, and Vicky, the other RTs, took the other children for testing for cystic fibrosis, which is actually a 30 to 60-minute procedure. So then the parents could be child-free for their education. Dr. Caverly, who was asking questions and guiding the team the whole way, was also able to provide assessment education during this carefully planned out appointment. The mother commented after the appointment was complete that she was very impressed with how well our team communicated and coordinated their visit. I was impressed too. After taking almost a whole afternoon in clinic, the parents had been educated, the other children tested, and all of the kids thinking it was related to their brother's sinus issues. This will now allow the parents to respectfully inform their children at home on their terms and with the words and with their words after having been prepped by the experts in the field. A diagnosis like this is life-changing for the child, but it's also for the entire family who will love and support them throughout their entire life. While the nominated group were handling the complicated case, the rest of the team was covering other patient care needs to allow that sort of time and resources to be devoted to this family. This is not lost on us. I'm honored to be able to work with a team this dedicated to patients and families.
Thank you to the Cystic Fibrosis Pediatric Program. Our next finalist for teams is C.N.M Family Unit for Child and Adolescent Mental Health and Wellness.
I'm honored today to introduce the C.N.M Family Unit for Child and Adolescent Mental Health and Wellness as a finalist for the Evan Newport Hope Award. The C.N.M Unit is a wellness and healthcare unit that offers youth struggling with mental illness and their families the opportunity to heal. It is a bastion of hope for youth with complex and acute mental health needs. As a 16-bed inpatient psychiatric unit, it serves youth with severe and complex psychiatric needs that are often comorbid with complex developmental, physical, or psychosocial needs. The unit is the only child and adolescent psychiatry hospital in the state that can serve the needs of youth with complex medical comorbidities and youth with eating disorders. It is also one of the few inpatient hospitals that can provide care for youth with developmental delay, intellectual disability, autism, and associated severe behavioral disturbances or aggression. Furthermore, during the recent COVID pandemic, the unit utilized innovative technologies, social distancing, and infection control measures with a focus on promoting ongoing therapeutic relationships and social connectedness. They did this all with limited disruption to the vital care they were providing. However, the influence of the C.N.M unit goes beyond its 4 walls and its 16 beds. It touches the lives of patients, families, and their community providers in ways that can be lasting and may significantly change the trajectory of youth that are suffering or have undergone tremendous strife. The leadership and staff on the unit are dedicated, compassionate, highly skilled, and empathic individuals. They lean into the vulnerabilities they may experience in working with a population with such significant needs for the betterment and benefit of their patients and families. The NIMAN unit staff provide this care with tremendous dignity, grace, and with an eye on holistic care and family engagement. I have been blessed to interface with my colleagues on the NIMAN unit and by what opportunity and hope that the unit affords in the spirit of this award. The NIMAN unit couples high-quality service, family-centered care, and innovation within a framework that highlights patient and family strengths and supports resiliency. This is all done with a lens towards developmentally and trauma-informed evidence-based care. I am so proud that the NIMAN unit has been selected as a finalist for this prestigious Evan Newport Hope Award. Thank you.
Thank you to the NIMAN unit. And our next finalist is the security team.
I'd like to nominate security for the Evan Newport Hope Award of 2020. This incredible team have taken their focus to new levels in this past year in extraordinary circumstances. Security staff have an ongoing presence that brings a sense of relief to most of us on every day, whether they're rescuing patients and families and staff in the parking lot to jumpstart their cars or help them find where they parked, or driving staff that are walking in the cold in off hours to their cars. This team comes ready to help. Many scenarios make logical sense. They help us find lost items, they investigate theft or suspicious behavior, they protect staff from threatening situations. But this team has gone further to ensure a comforting and effective presence to do what they aim. They not only reduce the anxiety of staff, patients, learners, and visitors, they help prevent it by constantly seeking to up their service and support in this community, our community. Tensions have never been so high in our organization, and we have new barriers for entering and reducing the number of people on site. This team has been asked to staff all the entrance points and think of ways to respond to every possible scenario. They help the many escalating situations, from everything from masks and check-ins and screenings and visitor limitations, and they do so consistently with friendliness, courtesy, respect, and sometimes even some music that can help put a little joy back into our days. They also partner with patients to improve their processes and even to hire new staff. There are just a multitude of little things that add up to the big heart that security has shown to be their mode of operation. And never has that been more so true than this year in 2020. Having each member of our organization show our patients we care makes a difference, and have security bringing it home adds up to the Michigan difference. Thank you so much, security, for what you do for us each and every day.
Thank you, security. And now on to Pediatric Audiology team nomination or finalists.
I couldn't be prouder of the Pediatric Audiology team being named as one of the finalists for the Evan Newport Hope Award. This team is such an outstanding example of patient and family-centered practices, such that I could draw from several stories and initiatives to talk about how deserving they are, but I'll settle on just two. The Family Matters Workshop was built following staff suggestions to meet patient and family needs that are not met through standard clinical appointments, with staff volunteering numerous hours in preparation and execution of a yearly workshop designed to support families of children with hearing loss. The design was heavily influenced by parent involvement and planning, with substantive improvements over the years, including inclusion of the entire family in the events. More recently, the team came together to provide care for the unique needs of a local Amish community, where over 30 children were identified by the team with genetic hearing loss. Providing dignified and respectful care, the team engaged in several meetings with the spiritual elders of the community to understand and address concerns related to digital hearing aids, ultimately partnering to find solutions which would meet the needs of the children in ways that fit with the unique needs and beliefs of the community. Due to significant challenges with transportation for many in the community, the team has engaged with the Michigan Department of Health and Human Services to establish a novel model for a field clinic incorporating physicians, audiologists, and speech pathologists. In addition to the dignified and respectful care provided to the community, encouraging and welcoming family participation and collaborating with community leaders to find a flexible solution to their needs and belief systems, the team was able to effectively communicate this need to MDHHS and create a novel funding model for the field clinic. I am confident that there are many fine examples of teams displaying HOPE principles above, but I'm really hard pressed to imagine another group who has modeled them as well and with such a significant impact for the communities they serve. So once again, congratulations to the Pediatric Audiology team and to all of the finalists.
Thank you to the Pediatric Audiology team. And so now you can see why it's so difficult to select the finalists, but let's get to it. The winner is Security. Thank you to Security. Brian, I don't know if you're on today. We'd love to hear from you.
I am. Can you hear me okay?
Sure can. Great to have you.
Well, thank you for having all of you. You've got multiple people in this room and you've been on this screen before. Well, first of all, we are honored. I can't thank you enough. This has been one of the most incredible 9 months that I can ever remember in my law enforcement career. And I think about it because this critical incident, if you will, is not something that you just manage at work. When you're done managing this at work, all of us, nurses, doctors, everyone, we go home and we feel this with our own families. So this critical incident isn't one that stops at the doors. And what we like to focus on here is, and you've heard this 100 times, is every healthcare system is a community and every floor is a neighborhood. And the only way you can keep a neighborhood safe is if we know the people who are in the neighborhood. And so our goal is not only to make sure we keep people safe, but more importantly, we got to make sure they feel safe. And that's really what we've tried to do. So thank you very much. It's an absolute honor, and we're just proud to be part of the team.
Thank you so much. It's so great to have you present, and I wish we could all be in the same room and cheer out loud together, but we'll make up for that down the road. But thank you for keeping us safe. You and the security team are real heroes in our mind, and I know it's been a rough year. So that concludes the staff awards for patient and family-centered care exemplars. For those that are able to stay on, and sorry, we had some tech glitches that put us a little bit behind schedule, but we also have our Joy Awards, which are our opportunity to recognize our patient and family advisors. And for those of you that don't know, we have over 1,600 patient and family advisors like Scott Newport that are our partners in everything we do. They help us make sure we're on the right track, working on the right things, everything from patient education to processes, improvements, resources, services, you name it. Security even involves having them in their interview teams, as do many other folks. So I'm going to hand it over to Melisa, who is a volunteer coordinator from our team, and she oversees the recruitment and engagement of our patient and family volunteers. So Melisa, over to you and the Joy Awards.
Good afternoon. My name is Melisa Cunningham. I'm a volunteer coordinator. I am so lucky to get to work with all of our amazing advisors and mentors, as well as all the staff that push our patient and family-centered care program forward. We appreciate all of you, and your work has been truly heroic this year, and thank you so much. If we could go to the next slide, I wanted to let you know a little bit about some of our nominated Joy Award advisors. These are advisors who go above and beyond, and we have many. This year, our those nominated include Chris Mosley. Congratulations, Chris, on also being a finalist. Chris has many roles within our program, and since he joined OP in 2017, he has really taken on a lot of work, including, and I love this, he's been writing articles for our advisor e-newsletter, which has been amazing. And Crystal Mrose, who I met very early, right after I joined, she also joined as an advisor. She's just a wonderful person, caring heart, and gives us back so much. Crystal is also a finalist. Rebecca Rains is one of our newer advisors, and she has done so much in her short time that she's been volunteering with us with the Cystic Fibrosis PFAC, and also serving as a parent partner, which is so important. So thank you, Rebecca. We also have Elizabeth Randall, another amazing, fairly new advisor, but as you can see, she's taken on quite a few roles, and also serves as a Hope Ambassador. So congratulations. Heather Stein is another amazing, fairly new peer mentor, and she actually helped us pilot a new mentor program within the psychiatric unit. And she's also a wonderful member of our patient family advisory committee there. Then we have Megan Tenyer, who is a finalist. She actually has been an advisor since 2011. And so she's a longtime advisor and just a wonderful member of the Cystic Fibrosis PFAC. We have Shatoria Townsend, who is also a finalist. She is joining a brand new project in the NICU called Little Victor's League. And it's going to be a wonderful program for parents of NICU patients. She also has joined a lot of other work within MOT primarily and does a wonderful job. And then we have Jennifer Weisbrod, who's a nominee, and she also, since 2018, has taken on quite a few roles. And the winner of this year's Joy Award is Megan Tenyer. So congratulations, Megan. Okay, so my first question is how does it feel to be a finalist for the Joy Award?
I am so incredibly honored and quite humbled. I had no idea they nominated me, so I was truly excited, and maybe that's the point, maybe you're not supposed to know, but I was truly excited to get that message. It means a lot to me. So I greatly appreciate it.
That's awesome. Well, I invited you today because I wanted to tell you in person that you actually are the winner.
Really?
Of this year's Joy Award. Congratulations.
Oh my gosh. That's so exciting. Thank you. Thank you.
I think it's so well deserved. And when did you exactly start volunteering with us?
I started in 2011, and that was with Mott Children's Hospital, actually, because I was still in a children's clinic then. But then I graduated and I moved on to the adult, and I'm just so appreciative of every opportunity that I've been given this entire time. It's been amazing, and it's been life-changing, I think, for everybody involved. So it's great to give back.
I just want to say a couple more words about Megan, who unfortunately couldn't join us today. As I mentioned, she had started volunteering with us in 2011. She was a founding member of the Adult Cystic Fibrosis program, which was created in 2016. And she's been taking minutes for them ever since, which if you've ever taken minutes, you know is a huge job. Megan had a wonderful idea to create a magnet for patients that indicate when to go to the clinic or go directly to the ER, and that's been implemented. She's also been instrumental in providing feedback on the mental health care element as the CF clinic rolled out the new patient questionnaires. Her nominator said that she has been instrumental working with the quality improvement team partners to create a better process for patients and staff, as well as helping to build working relationships with the lung transplant team. Megan shared challenges patients face, gave input in developing the workflow, and opened their eyes to the needs of communicating early with their patients when they are healthy about lung transplant so they're not blindsided. She helped with the transition process for patients from the CF clinic to transplant. They say that truthfully, without Megan, there is no way our QI team would be where it is today. She put so much time into completing assignments each week. In the past month, she devoted 5 entire days to QI training and site visits alone. Behind the scenes, she's constantly taking on more tasks and projects. Megan is a complete joy to have on our team and brings so much positive energy. While our team is overworked and struggling to complete tasks, Megan continues to encourage us and is a constant reminder of why we are doing this great work. So congratulations to Megan. I will move on now to the Celeste Castillo Lee Award. This is our Peer Mentor Award. Right now we have 30 different peer mentor programs, so we had quite a number of wonderful nominees, and I'll just quickly read through them. We have Mary Lore, who is a finalist, and she also was one of our pilot mentors for the Scleroderma Peer Mentor Program starting in 2014. We have Brenda Barker, who's a nominee, and she is a UCAN peer mentor, and she starred in our peer mentor video, which y'all should check out. It's really awesome. And she's volunteered at various other events. We have John Burko, who's fairly new, but he's taken on a lot of work for the heart transplant team. He's a mentor, always counted on. He's been in a focus group, and again, he is one of our newer mentors. We have Mark Geis, who is actually, I'm sorry, he sent the photo. I didn't get the photo in, but I apologize for that. But he is a longtime kidney transplant peer mentor. He is a wonderful mentor for all of the kidney transplant patients, and we just so appreciate Mark and all his work. He is, again, another finalist. We have Sherry Hicks, who helped us form and pilot the scleroderma peer mentor program in 2014. She's a finalist. And we have Mary Parker. Again, this is another new mentor starting in 2019, but she has taken on a lot of work, a lot of volunteer work. She is the only LVAD and heart transplant caregiver peer mentor, which has been really helpful to have that caregiver perspective and support. She's also been in a focus group, and she speaks about her experience for the pathology class. And the winner is Sherry Hicks. Congratulations, Sherry, and we're watching her video in a minute.
I can't believe it. I am just overjoyed, and it's a huge honor. I was reminiscing about Celeste just the other day, because when I went through the very first peer mentor training offered by the university for volunteers, she ran it and she was there. And she shared a little bit of her personal journey. And ever since then, I just had big visions of the scleroderma peer mentoring program just growing huge. And it has. I don't even know how many years I've been involved. I think like 6 or 7, maybe.
6 years.
Yeah, and being a patient, Dr. Dinesh Khanna and his whole team of paid people and patients and volunteers, it's just, I bet it's what Celeste, if she could be here, would have envisioned for peer mentors in general. So yeah, it's an honor and kind of unreal.
That's awesome. Well, I'm here to tell you and to let you know, and I'm going to try not to cry, that you are actually the winner of this year's Celeste Castillo Peer Mentor Award.
You are kidding.
Congratulations.
Oh my gosh. Elizabeth, hold on. So I just had told my husband, Melissa's on the phone. She wants to say something. We're going to Zoom about it later. And he said, are you the winner? I said, no. The university medical program is giant. There's a bajillion volunteers.
We have 500 volunteers who volunteer as advisors and peer mentors.
Wow.
But your nomination stood out to our entire committee for a variety of reasons. Your heart, the way that you handled a really tricky situation, a serious situation.
Mm-hmm.
And I was able to share that a little bit. And then also the fact that you took that experience and you're rewriting some patient education to try to help that program so that what you learned will be passed on to peer mentors from now and into the future. And
Wow.
We're just so pleased to announce you as the winner.
Gosh, Melissa. And I just have to tell you, I'm in a crazy, ugly sweater thing because we are doing a virtual scleroderma social hour with an ugly sweater party. And we're going to actually have a speaker who's going to help some chronically ill patients like myself.
Wow.
Manage through the holiday stress, even with COVID and stuff. So
that's amazing. And I know that Katie Hall and your other nominators wrote that you've been involved in keeping the peer mentor group and the patients together during this time. And it's such a time of isolation. So we appreciate that as well.
Wow, it's healing for me to be with them. And our program is unique because a lot of the other peer mentoring programs, I know, it's like, I'll use the transplant peer mentors as an example. They take their patients through usually a one-time situation. Mm-hmm. But with scleroderma, right now, there's no cure. So we're not on campus a lot. We are talking to them virtually or on the phone, and it's just a different program, but there's really not an end in sight for our patients. So it's just ongoing, and I get to meet more people that bless me. So wow, I'm speechless. That doesn't happen for me, Melissa.
Thank you so much to Sherry.
And Sherry's going to say just a few words. Sherry?
Well, I'm glad I explained why I had a Santa hat on, but
I just want to say I am so honored and thank you to everybody, but I'm not alone in this. The scleroderma peer mentoring program, and honestly, the scleroderma team, we're a family, and I'd give anything for this team. I think I was put on earth to help people, and my mom and dad both showed me the way. So I'm going to keep doing it, and thank you so much. This is just the honor.
Thank you, Sherry, and thank you to all of our Joy nominees and the whole group of our Hope Awards. And thank you again to Scott for everything that you've done to keep this going and to give us this inspiration. And thanks again to Darnissus and Quinlan and Kate, who were our team to put this all together. Thank you so much. I really do wish we could be together in person. You all bring me hope and joy, and I hope this does the same for you as we go about this hard work. Chins up and happy holidays to everybody. Thank you so much.